There's Jill. Hello, Jill. And hey, well, we got everybody. We're here.
Let's go.
Hey,
Thanks for inviting us.
hey, thanks for showing up week after week. So, hey, let's get going. Welcome, everybody. And today is February 18th. There is a rover attempting to land on Mars. Perseverance is doing that as we speak, hence my background. And therefore, perseverance is probably a good, it's also a good leitmotif for all of us here. Ryan, maybe can you tell us where is Nevada County at in the vaccine hamster wheel?
Sure. Yeah, I agree. Perseverance is a great word to describe and characterize our community over the last, I believe it's a year now, that we've been dealing with COVID-19. So from the efforts of our hospital treating sick patients, and now with vaccinating, and our public health department putting in grueling hours, and then just what our community is enduring. And so talking about vaccines and continuing to that rollout is just utterly critical in making sure that we can finally turn the page on this. And we have made substantial progress. So the state on January 29th began posting vaccines administered by county of residence. And on January 29th, the number that they posted was 5,754. And as of yesterday, the updated number is 16,300. So that's almost 11,000 in just 3 weeks. So over the last couple of weeks, our allocations have risen, and as they've started to account for our population over 65. And as I mentioned some weeks ago, we're tailoring our capacity and expanding our capacity to administer and match that growing supply. We've onboarded more high throughput partners. So Docomo's is in Tahoe Forest Hospital. And some of our high throughput providers in partnership with Sierra Nevada. We have implemented the Whispering Pines Clinic, where we're able to quickly turn over vaccine. And then of course, Sierra Nevada gets doses through Dignity, through Common Spirit, and has been able to put on high throughput clinics and provide vaccinations for their staff and their patients, as well, as I'm sure Dr. Evans will speak to. And then just as recently as last Friday, there's a new resource in the community. The federal government announced new partnerships with pharmacies, Rite Aid and CVS in California. And in Nevada County, the resource that we have through that new stream is the CVS on Combi Road in Alta Sierra. They're currently full, but that's a brand new stream of vaccine coming into the community that just came online as of Friday. So we've made substantial progress. We continue to move through vaccine as quickly as we are allocated it. And then we also now have the My Turn system, which many people who are on this call may have received alerts through that system. So the state has implemented a single sign-on system called My Turn, which you can go out to our website and register. And as we schedule clinics in the Whispering Pines location, we'll be putting those appointments out there so that people will get an alert if they're eligible and can go sign up for those appointments. So that's something people have been clamoring for some time, that's finally hitting the ground in Nevada County. So I'm pleased with our progress. I know it can't be fast enough. We don't have enough vaccines for it to be fast enough to get to everybody all at once, but that's where we currently are. And I'll turn it over to others.
Okay, thank you, Ryan. And Jill, so last Friday we got the tour of the new Whispering Pines Clinic, and I now have a first-hand account, actually from Ubinet's publisher, who got her vaccine yesterday, who was extremely pleased with the setup and the flow. And so to quote Susan, she felt extremely safe because the social distancing, and it's really open, and everybody. All the questions were answered. So My Turn, there have been some hiccups, of course, with My Turn, because some people sign up and then they get a response that, yes, we'll contact you, and then they are never contacted, and then they try again, and all of a sudden they can schedule it. Do you expect the system to get a little better? And what if you're signed up with My Turn, and let's say all of a sudden you get a call from from a provider saying, hey, come on in. How does that work? And let's say somebody gets a vaccine out of county. Will they have to cancel? Is there a way to cancel? And are those vaccines counted towards Nevada County?
Okay, there's a lot in
There's
there.
a lot, yeah.
So I'm so happy to hear about the positive experience at the clinic. The space, which was donated by Sierra Nevada, is wonderful, and Dr. Kellermann was really key in making that happen. I will say that we have really experienced clinicians, and they put on clinics all the time, and they utilize best practices to make sure that the space was welcoming and inviting, and that people had the time to ask the questions they might have about the vaccine, and have a positive experience, as positive as one can have when they're going to get a shot. So thanks for that positive feedback. And we have a terrific team working there. So we're glad we did the soft launch last week and worked out some bugs, but you're right, there are still some bugs, and some bugs with the My Turn system. So we're one of the early counties to be utilizing the system. And you're right, Pascal, that we assumed everybody was receiving notifications when those appointments went live, and then we found out that wasn't happening. Yesterday, we thought we had that rectified. Today, we got news that maybe that's not rectified yet, and it might take a couple weeks. So when we have better detail about what the issue is and when it can be fixed, we'll make sure to put that out publicly so that people know and have realistic expectations until that feature is turned on. But that is the intent of the system, is that people receive notification when appointments go live, and that will happen about once a week. So if somebody gets an offer of an appointment from another practitioner, I say by all means take it instead of waiting for My Turn. If they're able to travel and if they're able to accept a vaccine that's being offered to them, I would encourage them to do so. If they're doing that in lieu of an appointment they have scheduled, yes, we would ask them to cancel that appointment. I believe they can go into My Turn to do that. But right now we're only scheduling appointments a week in advance. So my guess is that won't happen too often. And if somebody struggled with My Turn and canceling an appointment, they could always call the public health department and we could help work them through that issue. I feel like I got a couple of the things you talked about. I'm not sure if I got everything.
Oh, you get most of it. So, Dr. Kellermann, if somebody gets a vaccine outside of Nevada County, will they be counted as a Nevada County resident being vaccinated? Is that going to count towards the statistics for Nevada County, or is it just going to be somebody? Will they be counted towards Placer or Sutter or Yuba, wherever they go?
From what I understand, it's what we're doing is where you work. For instance, we immunized all as many teachers as we could between K through 12. If they work here, we count it as here, even though they may have commuted from other counties, Yolo or Placer or something. So we count them as part of our cadre of people we immunize. And my assumption that's taken on by the other counties also. If people from Nevada County work elsewhere, then they get the immunizations elsewhere. Is that what you're understanding?
Yeah, can I do one point of clarification? So that's true, what Scott, Dr. Kellermann, what you just said, that'll show up in our count of people that we have vaccinated. But the way the state is recording vaccinations on the state's website, that's by county of residence. So if somebody works in Nevada County, lives in Placer County, on the state's dashboard, it's going to show up as under their county of residence. So if they live in Placer, it will show up as Placer, and vice versa. If somebody gets vaccinated out of county, lives here, that will show up in Nevada County's count on the state dashboard, because they're reporting it by county of residence. But okay. You're right, Dr. Kellermann, in that our numbers reflect who we have vaccinated, regardless of county of residence.
And still, reporting is not all it could be. The way the state is getting the information, we're hoping that when My Turn gets rolled out, that everybody are reporting the same way. Right now, they're using different systems. The hospital, I assume, is still using Cerna, and Tahoe Forest is using something called PrepMod. So there's a variety of information systems that are giving reports into the state. So we hope to have it all centralized under My Turn. It seems to be very efficient and relatively user-friendly and intuitive. I would encourage anybody out there, make sure they click on myturn.ca.gov, because there's a couple of other ones that are more proprietary and want to sell you something. the myturn.com or the myturn.org will not be helpful. So make sure they click on the right one.
Mm-hmm. Yep, and again, that is myturn.ca.gov, and yes, don't go for substitutes. Dr. Evans, lots of people that contacted us and said, hey, I got a call from Sierra Nevada, but it was weird. I didn't know it was really them because they tell me to call a Sacramento number. So what is Sierra Nevada Memorial Hospital doing?
What are we doing? A lot. We're doing a lot. Let me first start by saying that I really appreciate Jill, Ryan, Dr. Kellermann, and everybody at the county for really, I mean, you guys have been working insanely hard for a long time to sort out this vaccination rollout, which has been, I think you just described it, Pascal, as a hamster wheel. It has been really complex, not just for Nevada County, but for the entire country. Because, you know, the federal government has been sort of in charge of the overall distribution of vaccines to 50 separate states who have 50 different approaches to this. And then each state is then giving out the vaccines in a variety of different ways to each of the counties in a way that is actually quite complex and in my view, somewhat unnecessarily complex. And so then we're all here trying to react to that and trying to deal with the logistics of it. And it's changing constantly. Actually, the changes are hard to keep track of in terms of how the vaccines are allocated and what the rules are with the tiers and everything else. So that's the backdrop of how difficult this has been. The hospital has been receiving vaccines, a minority of the vaccines, about 20% of the vaccines, as opposed to the 80% that are going to the other different distribution channels in Nevada County. And our task is to administer those vaccines as quickly as we can to hospital employees, physicians, volunteers, and patients in the proper tiers that are part of the Dignity Health Medical Group. So if you've got a physician who is part of the Dignity Health Medical Group, and those doctors are Dr. Fitzpatrick, Dr. Kanamata, Dr. Lucas Ross, and Dr. Holtrop. So those are the primary care doctors that we're vaccinating those patients. So those are who we've been focused on. And then the other majority of the vaccines are being distributed through other channels to the rest of Nevada County citizens. We're also partnering with the county in a variety of different ways to make sure that we're helping wherever we can to vaccinate the entire community. And that includes the Whispering Pines Clinic location. So that, I think, is going to be a good sort of a long-term, stable place for people to get vaccinated. So it's not just a one-off clinic, it's more of a regularly occurring daily clinic. And we certainly want to help support that one. With regards to the phone call issue, Pascal, so you said people are getting a phone call. So these would presumably be patients who are part of the Dignity Health Medical Group. They get a phone call from us. If they don't answer their phone, we leave a message, and then we have them call the phone number that actually is a Sacramento number, but those people who are answering that number are able to register them for the next upcoming Sierra Nevada clinic. So that's why that's happening. So I can understand it might be a little bit confusing. That's kind of where we are right now. We've hosted, I believe, about 25 clinics at our campus. We've been vaccinating people as quickly as we actually receive vaccines, and we're doing it by the tiers that were given by California, the Department of Public Health. So that's kind of where we are today. And I think that the question I'm getting asked by everybody is, when can I get my vaccine? You know, where do I get it? When can I get it? And as this thing increases, people are going to be able to access vaccines. I will point out, though, the numbers of COVID patients in hospitals has been declining, not just in our community, but across the state of California and the whole country. So the numbers have been falling, and that's been really good to see. When we were at our peak of this, I think we had 15 admitted patients in the hospital. Some of them were quite ill, and now we've been 4, 5, 6 patients in the hospital. So I'm feeling cautiously optimistic at this point in time. Obviously, we want to make sure we keep doing all the things that got us to this point of improvement. We want to keep the vaccines going. We want to make sure we keep wearing masks and doing the social distancing and all that stuff, because we don't want to see an uptick again if we sort of take our foot off the gas. But I'm feeling better about where we are with this pandemic. Obviously, everybody's watching the variants that are out there, the different COVID-19 variants, and wondering how that's going to play out. But right now, it looks like we're making significant progress.
Okay, well, let's get to the questions that our attendees here have in the chat. Do vaccines seem to be more available through some of the chain pharmacies than Nevada County Clinic in Truckee?
Sorry, can you repeat that question, Pascal?
It seems that it's easier to get a vaccine in Truckee through one of the chains, the pharmacies, than through the clinic. So I think that goes back to the supply again.
Yeah, I mean, I'll just mention that one of our roles as a public health department is to distribute the allocation that our local health jurisdiction gets, and some of it is going to pharmacies, and one of those pharmacies is in Truckee. And then the hospital is another significant vaccinator up there. Right now, as we're prioritizing those people who are 65 and older, many more people 65 and older live in Western County than in Eastern County. So that might also lend itself to ease of scheduling an appointment, if I understand the question correctly.
I would like to say that Tahoe Forest is, because all the primary care providers work through Tahoe Forest. And so it's a more centralized system than we have on Western Nevada County. And apparently the docs, all the primary care providers have been in communication with the administration of the hospital. So they're pretty dialed in. They're pretty well organized up there in Eastern County, and been very supportive of this immunization program. So it's been a good collaborative relationship. I mean, similarly I would say with Dr. Evans, they have offered some incredible support for us, particularly Whispering Pines. And, I'd like to also say, if I can follow that up on Pascal, is that we work with Freed to make sure that our place is ADA compatible and that the experience is as positive as can be for anybody with any kind of physical challenge. But again, that's a work in progress, but the feedback we've been getting from Whispering Pines, thank you, Dr. Evans, for that facility is very, very positive.
And speaking of Whispering Pines, when are appointments available for Whispering Pines, and are they released a specific day of the week and what time? So in other words, when do you really have to sit there and refresh your browser? Is that the deal?
Yeah, so right now, very unfortunately, that is the deal. I do want to say that the My Turn system was designed very quickly for counties, and it is now being revised with input from counties. So it's a work in progress, and I know I told my team here that it's probably going to be a perfect tool in about 3 or 4 weeks, but there are some glitches, and yeah, the refreshing of the browser is really limits who can access those appointments, and that was never our intention, but unfortunately that's the temporary scenario. Because this is our first week where we've released a lot of appointments for that clinic. We don't have a routine down as to which day they'll be released and what time. But since those notifications aren't going out, that's probably something we can communicate pretty broadly, so that people, it's not just luck of the draw, that people can anticipate when that's going up. I don't know yet when that will be for next week, but it's certainly something for us to consider until My Turn's notification system starts to notify people.
And also we have people who are not online, and so we get some calls about people who are really confused and how can they get help to sign up, because senior population, they are now eligible, but they don't have a computer. So how can they sign up? Who can help them sign up?
That's a great question again. And so My Turn is not the only way that people are getting signed up for appointments. As Dr. Evans indicated, there are primary care providers through the hospital who are vaccinating their patients. We're distributing vaccine to other primary care physicians who are vaccinating their patients. There are pharmacies that are vaccinating patients. We know that Docomo's maintains a wait list. Someone could, but I'll just say, so there are other mechanisms, but we are working on just what you're talking about. So we've talked about partnerships with a couple of different local organizations who can help assist with that. And then a function that My Turn just created that we can tap into is a way for us to schedule a clinic that one would need a certain passcode in order to register for. So we can create a clinic for people who don't have computer access, and then, for example, work with a community partner who may be able to register those folks who don't have computer access. But this will be ongoing planning on our department's part. We know that we'll need multiple solutions to that issue, and the state's aware of that as well. That there are plenty of parts of the state that don't have good internet connectivity, people who don't have the right technology. And so we're all working to tackle that issue. It will take a little time, but we are vaccinating folks who don't have computers right now, again, through some of the pharmacies and healthcare providers, as well as through some of the public health clinics. It will get better.
May I have somebody who is really obviously quite, let's say, excited here. Answer the question, how do I get a vaccine? myturn.ca.gov does not work. So it may or may not work, but yes. So.
Ryan, you're on.
I mean, my turn works first, has some hiccups as we've been talking about. It does work, and it's going to be working better. There are other ways to get vaccine as well. There's a link where you can sign up for the CVS appointments when they become available. I can share that in the link. We also have a list of providers on our website, which includes links out to how they're taking appointments. Some are maintaining waiting lists, some have online registration or a phone number to call, so I can post that out. Ultimately, my turn will be the single source for appointments, but for now, there are a variety of methods depending on the provider, and I'll try to post out some links that will assist with that.
If I can just add two other things to that, that is that we have 2 additional healthcare providers that are coming online very soon. So those patients, they'll be working to identify their patients who qualify. So that will increase access. And then something else that we're going to be putting together is a form that people can fill out if they want to be on a wait list where they could be notified with short notice. So if it's, we have a clinic and, once you pierce a vial, you have a limited amount of time to use that vaccine. And if there's somebody who doesn't show up, or if we're 2 appointments shy, that we can tap into this list of people who think they can respond with relatively short notice to show up for a vaccine. And if that does happen, we'll work them in for a second appointment as well. So once we release that, people could certainly sign up and try to make use of that mechanism as well.
That is the put your name down and we'll call you if there's any extra, and then you better hurry up list.
That's the list.
Okay. We have somebody who is, that's a question for Dr. Evans. Actually, there's several questions for Dr. Evans. And no, it is not political. She has registered, she was told by Sierra Nevada Memorial Hospital she could not get the vaccine because she is not a patient. And how come that a community clinic has the right to refuse somebody from Nevada County? She also says that that would be to acknowledge that problem, which is not necessarily a problem, which is probably just a way of how you handle the limited supply of vaccines. But please go ahead.
Well, I would again, the vaccines that are coming into Nevada County, the vast majority of those vaccines are coming to Nevada County, and then a small minority are coming into the hospital. About 20% roughly are being allocated to hospitals. So we are directed to give those vaccine doses to patients that are in the Dignity Health Medical Clinic, our employees and physicians and other healthcare frontline people, including volunteers. That's what those doses are for. And then if there's any left over, we will absolutely be looking to give those to the county and, distribute them to other people. The problem that I don't think we've mentioned yet is the production of vaccine in this country has not been at a level that we can all immediately get vaccinated right away. On the one hand, I'd say that it was remarkable that we actually had both a Pfizer and a Moderna vaccine become available as quickly as they did. That was surprising to many scientists and many people, but there was a lot of effort to make that happen. But it's not like you can just snap your finger and make 600 million vaccines appear overnight. So that production piece is what has limited not just Nevada County, but the entire country, so that we can't vaccinate everybody simultaneously. But again, the vaccines that we get at Sierra Nevada are allocated specifically for employees, doctors, and patients in Nevada County of our Dignity Health Medical Group. And then we're partnering with the county however we can.
Okay, thank you.
You bet.
And we have questions about, so if somebody wants to actually volunteer, she was lucky she already got her first shot, and is there a way for people to volunteer to help get people signed up, especially for people who do not have the internet connectivity? Where could she go to volunteer her time?
I don't think we have a specific location for people to volunteer their time to do exactly that task yet, because we haven't solidified the relationships with the community partners that are going to help us with that task. I can say from the county's perspective, and I think everybody on this call knows this, Pascal, you know this, everybody who's listening knows this, we have a remarkably generous community. We've had so many people want to help and volunteer their time. From the county perspective, we utilize volunteers who are registered at healthcarevolunteers.ca.gov. That's the Disaster Healthcare Volunteer Database. But I do want to say we have not yet been able to make use of a lot of those volunteers. But if somebody wanted to volunteer for the county, they could register there. And while we're not utilizing a lot of volunteers right now, that will likely change over the course of time. And then if we end up partnering with an organization who's helping to enlist or enroll people into MyTurn, or for appointments, people who don't have computers, then we can certainly put that call out for volunteers as well.
Yeah, I would like to add, Pascal, if somebody really has that interest, you don't have to go far. This is a neighborhood thing. This is all a function of being a good neighbor and being a friend. And if you have people are shut in and have problems, or internet challenged, and have issues of transportation, step up to the plate, help them out. This is one way the whole county can come together to get us immunized, because these are going to be the hard to reach people. And it usually is done by an advocate or a friend.
And when are the Tier 1B food and ag workers, when are they are technically eligible now, but realistically, when can they expect vaccines?
That is also an excellent question from the county perspective. So when we got into phase 1B, we vaccinated some in the emergency services sector and in the education and childcare sector. And then we, like our neighboring counties, and as Dr. Evans mentioned with the new variants in the state as well, we made a conscious decision to prioritize those who are 65 and older, because they're the most at risk for serious illness and death from COVID-19. But it will be opening up probably in the next few weeks to the other sectors as well. 65 and older will still be prioritized. And I think the state will even ask everybody who's providing immunizations to portion out some of their vaccine, with most of it going to 65 and older, and then some of it going to the work sectors that are listed in phase 1B.
That includes a lot of people, Pascal. When we look at those numbers, it's we're looking over a third of our county.
It's a lot of people, and it's a lot of people that we were all very glad when the first and the second and the third stay-at-home orders, the essential workers that showed up every day. So yeah, and it includes a lot of people, and we should be quite thankful to all these people. One of the we're going to wrap this up here very shortly. So we have, is there a way at MyTurn to check on registration, to see if you are registered and the status? Is there a way to do that?
I don't know the answer to that.
From a public perspective, hadn't seen it because, of course, I tried to sign up as well, and since I'm not quite in the age category, it was like, yeah, no, not you.
It does allow you to register, and I just tried and I couldn't find any way to check on your registration status, and it actually let me register again. So I assume that means I'll get two emails when I'm finally eligible.
Last question. Somebody moved to Nevada County 2 weeks ago, and her husband got his first shot in Washington on February 1st. Will he be able to get a second shot here in a timely manner? First, welcome to Nevada County.
We hope so. I mean, he shouldn't have to go back up to Washington. I'm sure that's not DC, but that's still a long drive or flight, and you're not supposed to be traveling. Surprised he moved during this time, but yeah, there are options for people who receive their immunizations. But I would say with the proviso, if you happen to go to Placer County for your first immunization, go there for the second. They're planning for you to return. And if he gets it, if they get the immunizations here, please let the facility know in Washington that you received immunizations here, or so they're not planning, you're not taking up a spot there back in Washington. And that's one of the things we have is if people don't show, then we're trying to race around, try to find people who will replace the ones that were supposed to have come, and we already have immunizations that have thawed and ready to be administered. So it's usually best wherever you've gotten. If you can't if you plan not to get a second shot where you are, make arrangements to get your first and second shots together. There's a little proviso right now. We got the polar vortex is preventing immunizations from, crisscrossing the country like it should. So we're not sure what the supplies look like over the next few days. So stay tuned. We'll know more by your show next week, Pascal.
Yes, and I believe that next week we can talk about vaccines coming, the doses coming in or not. For now, fingers crossed that first of all that all the the polar vortex and all the damage is done in other states. So first of all, that hoping that everybody's okay there, and that it doesn't disrupt logistics as much as feared, because there are a lot of people that are waiting here and very eager to get these vaccinations. And so it would be great if what the governor predicted, which is increase from 1.2 million this week to 1.6 the next week and 1.8 the week after, that would be really nice if those doses would all make it to California, and a sizable portion to Nevada County, hopefully.
Right. We're ready. Working together.
All right. Well, with that, I would like to thank all three of you. I believe Dr. Evans had to run off to another meeting. So thank you, everybody. Thanks, everybody who was live with us here, and we'll have this up on YouTube very shortly. Thanks again, and we'll see you next week.
Thanks, Pascal.
Thanks, Pascal.
Bye.
Yes.